Hello, everyone. Welcome to episode 3 of our series, Doctor's Aspect on Healthcare. Today, we are talking to a very special guest, Dr. Ina Husain. First of all, thank you for taking the time out of your busy schedule to be here today. Let's get started. So, how are you doing today, Doctor?
I'm doing well. Thank you for inviting me to speak today.
It is our pleasure to have you with us. Would you like to tell our viewers a little bit about yourself and your specialty?
Sure. So I am an academic laryngologist. A laryngologist is actually an otolaryngologist, or also known as an ear, nose, and throat doctor, who has done additional training to specialize in the throat, or also known as the larynx. And so I primarily manage conditions related to voicing, difficulty swallowing, difficulty breathing, both medically and surgically. So that is kind of my specialty and what I do.
Thank you so much. So, Dr. Hussein, can you tell our viewers where you're located and where you practice?
Sure. So I'm actually speaking to you guys right now from where I work. I am actually a section head of laryngology at Rush University Medical Center, which is located in Chicago.
Did you always wanted to become a doctor, or was there a particular moment when you realized that medicine is your calling?
Sure. So I actually grew up in a family where there was a lot of physicians. So I was very well kind of aware of that as an option. My path actually took a little bit different turn. I was actually interested initially in public health and health policy. And because of that, as an undergraduate student, when I was in college, I actually studied abroad in South Africa for a semester. And while we were there, we were doing a lot of community outreach work with a local village in which a lot of the members had HIV and AIDS. And I think the moment came for me when I decided to switch paths was when I met one of these patients who was actually the same age as me at the time, and she was actually dying of AIDS. And I think just kind of speaking with her, and she kind of, came in and was like, I know why you guys are here. You're trying to help with policies and protocols, but what are you actually going to do to help me? And when she said that, I think it really affected me in kind of this desire to kind of have that one-on-one interaction with people to really help solve an individual's problem primarily. And so I think that was my focus, away from kind of a career in public health and more in a career in actually treating individual patients. And that's how I got into medicine.
That is honestly the greatest thing about being a professional, right? When you actually get your calling from the environment and you're actually interacting with all these people. Um,
Right.
so, what's your opinion on healthcare in the United States? Are there major shortcomings and strengths according to you?
I would say that the topic of healthcare in the United States is actually a really complicated one, right? Like nothing's very straightforward or an easy answer. I think it would be a lie to say that there are no shortcomings. There's definitely shortcomings within our healthcare system, and I think a lot of those have to do with access to care being a big issue, and then the difficulty in kind of navigating the healthcare system. So that's a little bit different than access to care. Even if you technically have access to care, meaning good healthcare system located near really great hospitals, just trying to figure out how to go about getting care can be difficult. And then the cost. And so even with, official insurance and everything, the cost can just be so burdensome that it makes it difficult to really take advantage of that and get healthy. Now, at the same time, I think there are definitely some benefits to the healthcare system in the United States. I think one of them really is a sense of kind of collaboration and innovativeness. And I think we see this a lot of times in academic hospitals, but also in community hospitals as well, where there's a lot of funding that's going towards research and innovation and getting that out to patients through things like clinical trials and clinical research. And I think that's a really robust part of the US healthcare system that makes kind of one of its strengths.
And I know you kind of mentioned this, but does everyone have access to healthcare there? And are there changes being made to improve this? According to your experience, what
Mhm.
impact does this have?
So I would say that no, everyone does not have access to healthcare in the United States, and unfortunately, that is just the truth of the matter. I think access to care has to do with things such as socioeconomic status, where you are located, and also just lifestyle, right? So if you have two jobs and you can't afford to take time off, well, that's also not having access to healthcare. So there's a lot of people, unfortunately, in the United States that do not have access to healthcare. In terms of are there changes that are being made, I would say yes. I mean, I think the first, whenever you are faced with a problem, is to identify the problem and acknowledge it. And I think in this country, we are now vocally acknowledging that a disparity in access to care does exist. I don't know if it took something like a pandemic to bring that to light, but people, I think, especially healthcare professionals, are very vocal now about being champions to try to create change. Um, on an individual hospital system basis, there are a lot of programs that hospitals are now creating to try to provide care to different communities that in the past have not had so much access. And that is things like mobile healthcare units, outreach, kind of like a marketing type of program to get information out to people. And so there are different initiatives kind of being done so that we can capture more patients and people who need healthcare.
Absolutely. And that's really insightful. Thank you so much. So, now let's talk about the biggest predicament facing the world, COVID-19 pandemic.
Mhm.
How has COVID-19 impacted you professionally as well as personally?
Sure. I mean, I think, everybody in this world has been affected by COVID-19, the pandemic in some way, one way or the other. For me professionally, so as a laryngologist, I am in the upper airway. That is where I do my work, right? And so you can imagine that my evaluations in the office require essentially scoping through the nose and the throat. I mean, one of my specialties is actually chronic cough. So I have a practice full of people who are chronically coughing in the office. And so this was very kind of, stressful initially when this all came because this is a upper respiratory, a respiratory virus. And so, in terms of my practice itself, initially, our entire kind of hospital system shut down in person visits. And especially within our department, we very quickly adopted PPE, and we were thankful that we had access to that. So, but by about May, we started kind of seeing patients in person with our PPE. And to be honest, I still to this point wear that. So, in terms of my interactions with patients, so I now I wear an N95 mask, I wear a face shield, I wear a scrub hat, I wear scrubs. I actually had to put a picture of myself in my office for patients who are new to the practice so that they could see what I look like who they're talking to. Um, we've done precautions where patients have to wear masks even during procedures. And if I do anything really invasive in the office, such as vocal cord biopsies or injections or things that are more manipulative in the upper airway, I have to get COVID testing just for safety reasons. So I think that's really affected. Kind of the flow of the practice. I would say that I still see everybody, right? So this was my calling to be this type of physician surgeon. And so I still see everyone. I just protect myself every time I do it. And so it's kind of a new groove. And with things kind of changing now, we'll see if that really changes my practice, or I just may continue to wear a mask for the rest of time.
So, additionally, what impacts do you think COVID-19 has had on access to healthcare?
Sure. So, in terms of access to healthcare, I mean, I think it's very well documented that COVID-19 affected different communities in different ways. And most of this is when we talk about people of color. So, high rates of kind of death and morbidity in patients of African American kind of descent or Black descent compared to white Americans. And that's like a huge disparity, right? So, I think that COVID has brought that even more to light that different groups are affected differently, and that's kind of the biggest one. I would say other kind of issues that have brought to light are kind of the long term or the long haul symptoms of COVID-19 that patients are facing in terms of who has access to a pulmonologist in the outpatient setting to continue to follow up for shortness of breath, um, who has access to see somebody such as myself, a laryngologist, for persistent hoarseness or voice changes after COVID-19. Um, so it's not just, getting diagnosed and getting treatment properly. It's also what happens with the chronic effects of it. Do you have access to care? Do people help you through that? Do you have access to the rehab services that help you get better from having, a devastating disease? And I think that's also an area that's kind of lacking inclusion, and an area of disparity for these patients, unfortunately.
So long-term care must also be looked at, is what you're telling the viewers. And I think myself, I didn't know much about the after effects of COVID-19, and I feel like that
Mhm.
needs to be advertised a little bit more, or just talked about a little bit more. Um,
Right.
so, do you think changes are being made specifically because of this pandemic, or are there changes being made at all?
So, with regards to kind of access to care, you mean?
With regards to the pandemic, or yeah, I guess access to care, but also
Sure.
the disease itself.
Sure. So, I mean, I'll say that this pandemic has kind of really shaken life in the US or the world as we know it, and is specifically within kind of healthcare, right? So, how hospitals and clinicians and everybody operates is going to be forever changed because of this pandemic. I think a couple of things that come to mind. One is, this more kind of being vocal about the disparities that exist. I think currently, a lot of that is being focused on kind of access to care regarding COVID-19. But I think that it starts the discussion. And so then that can translate to other things like access to care regarding cancer, for example, or cardiovascular disease or diabetes. It just brings to light that, like, all of these individual disease processes, there's differences between kind of who can access care for them and who can't. So I think it's bringing to light more of these underlying issues that have been here for generations, and just haven't really been spoken about. So that's one thing. The second thing regarding kind of COVID-19 is that now we're in the phase of trying to get everyone vaccinated, right? So we're trying to get the vaccine out. So currently in most states, it's just available to kind of frontline or healthcare workers, and then moving along into high risk groups. And so one of the discussions that's come out is, how is this vaccine going to be distributed, right? Like, if you're just going to distribute it to kind of the downtown main hospital, are the people who are really dying from it going to get access to it? And that's like a big question. And so I think, at least at my institution, one of the things we're trying to make sure is happening is that the communities, especially in the south side of Chicago, where we know a lot of people were affected by COVID-19, somehow have access to this vaccine, right? So it can't possibly just be, oh, come on into your normal hospital. Well, these patients may never see a physician. Where will they go to get the vaccine? So bringing it to a way that is easily accessible for them, helping them get information about when the vaccine is available for them. They may not have cell phones. They may not have emails in which to check to see. So I think a lot of this will be about changing how we approach those groups, about information about the vaccine.
Absolutely. So, in many underprivileged areas, COVID-19 was remarkably severe, as you've mentioned,
Mhm.
some areas. What do you think we as a society can, how do you think we can help them?
I think that's a really difficult answer. And the reason for that is help needs to come in a multitude of ways, right? It's not just let's help them get a COVID test or let's help them get admitted when they need treatment for COVID. It's more about let's do all of that, but also, how are they going to get dinner for their children if they're admitted to the hospital for 3 weeks? Right? Like, what's going to happen with childcare if schools are closed because this pandemic continues? Um, I'm a working mom, and I'll tell you, even in my position, and I will say as a healthcare worker to a certain extent, there's amount of privilege that I have, right, comparatively, but it's been a struggle. I mean, with schools closed and stuff, it's been a struggle, and I can only imagine for other families, where they're very reliant on their hourly wage, it's going to be even a bigger struggle. So I think providing resources for things like childcare, access to food. Um, there's a lot of kind of food deserts in this country, and a lot of people, including children, go hungry every night. And so, remembering that those things are exacerbated whenever there is something like a pandemic or an emergency state in a city or a country. So focusing not just on how do we get patients, COVID-19 testing and vaccine, but who's taking care of the children, who's making sure that there's food on the table, what kind of resources are available for kind of economic stability. And if that's not there, those communities will not survive.
Absolutely. So, probably a more holistic approach would
Definitely.
help them with that. Um,
Definitely.
do you think the information we're receiving from the media about COVID-19 is
Mm.
adequate? Is there any part of it you'd like to emphasize or perhaps exaggerate? Any important point?
Yeah, I think overall the media is doing a pretty good job in terms of kind of expressing the severity of what's happening. I think most of the problem is that people don't want to listen, right? So it's not that it's not information's not out there. I think some more personal stories may have a bigger impact as opposed to just like putting up big numbers of hundreds of thousands of people infected. I think people need to see that these were actual people. These were your neighbors. These were your family. These were your friends. Who are these people that are being affected by COVID? I think there's not enough demonstration of what it's like kind of in hospitals and on this end, like what it actually means. You may see a picture of us wearing a mask, maybe a shield. Um, but there's a certain amount of trauma that comes from being continuously bombarded by the possibility of getting sick yourself, possibility of spreading it to your family, possibility or watching people get sick and die. And so I think a little bit more personal take on it. If the media did that, I think it would just touch people in a different way and reach people who maybe are not being reached currently.
For sure. Especially knowing that you're a doctor and you're every day exposed to a lot of risk. I think that would really show personal stories and
Right,
help people connect on a personal level to the
right,
pandemic, and the numbers not being just the numbers of death or the number of cases, but it actually being people being affected, right?
right. Definitely.
So, amazing. It was amazing, honestly, listening to all of that. I'm sure
Thank you.
super informative for our viewers as well. My next question is about how your experience was getting the COVID-19 vaccine.
Sure. So at my institution, I was part of the kind of first group. So the first week of vaccination. So I'm actually getting my second vaccine this weekend. I would say that, our system was actually really organized. It was in terms of the process for me. I received an invitation. I was able to schedule. I was able to kind of walk in and get the injection. I did pretty well with it. I had definitely some muscle aches that night, but nothing that was kind of persistent past the next day. I was able to work out, hang out with the kids and stuff the next day. So it wasn't that type of problem. I think it was incredibly overwhelming and an emotional experience. I'll be very frank. Walking into the kind of vaccine hall and watching all my colleagues get vaccinated. I mean, I think we shared a lot of kind of like an emotional connection, like finally seeing that maybe there's some possibility that we could get over this pandemic. So it was a very emotional time, to be honest. I'm waiting for my second dose now. So I'm kind of excited for that. Watching kind of family and friends start to get vaccinated. I mean, it's just a very overwhelmingly emotional experience. I think part of the emotionality that comes with it is when you live day to day, faced with what is actually happening, right? Like we're not quite isolated from it. So when you hear about people dying from COVID or seeing the sequela like I do in the office of people who are really sick and now don't have a voice, have trouble breathing, can't swallow, it really shows you how devastating this disease is. And so the ability to get the vaccine, I mean, it was amazing. I just hope that it quickly gets distributed so that everybody who wants one can get one. That's really my hope for the future.
And I'm sure it probably just felt like a moment where you see the light at the end of the tunnel and it just
Right.
brings
Very
hope,
hopeful.
right? So, what was the whole procedure like in terms of your
Mhm.
symptoms or anything like that with the
Oh,
vaccine?
from the vaccine?
Right.
Sure. So I would say that the vaccine itself didn't actually really hurt, and I'm kind of it's kind of funny, but I'm actually scared of like needles, so I was a little bit nervous. Um, I actually had a pharmacist and a pharmacy tech, so the pharmacy tech actually gave me the injection. They actually go about two finger breaths below your shoulder, inject a few seconds. Went home, I was fine. About 3 or 4 hours later, I would say that I started to feel some achiness in that deltoid muscle, a little bit of achiness in my back. And that kind of continued over the evening. And then when I woke up in the morning, kind of generally just some soreness. If you guys have ever received like a tetanus shot, it kind of felt like that, but probably a little bit more. But by the next day at noon, there was really nothing. So it was actually not bad at all. Yeah.
That's really good to hear. Um,
Yeah.
so that is all we have for the interview today. Thank you so much, Dr. Hussein.
Yeah, of course. Thank you for having me on. It was a pleasure.
It has been wonderful talking to you, and thank you for all that you are doing in the community. I'm
Appreciate it.
sure everyone watching today have gained some valuable knowledge from this.
Mhm.
And I'd like, lastly, also like to thank all the viewers, and please remember to stay safe.
Thank you.